My name is Calliope, and I'm going to be performing your extraoral examination today. Thank you so much for letting me practice this examination on you. How are you doing today? That's excellent. I hope by the time you leave our little practice area that you feel even just the littlest bit better. So our extraoral examination today is used for screening for different oral cancers. We're going to be looking for any masses in the muscles around your face and your neck. We'll be checking your lymph nodes. We'll be doing just a few different tests here and there. So I'm going to ask you a few questions first, if you don't mind. Okay. So firstly, what is your name and date of birth? Okay. Excellent. Just get that date of birth down. Wonderful. Okay. And what is your preferred name and preferred way to be addressed? Okay, that's wonderful. We can certainly do that. Thank you. So, I'm going to ask you a few medical history questions before we begin on the actual exam, alright? So firstly, are you in any current pain or experiencing any current discomfort at all? Okay, very good. Alright. And any changes to your medical history other than what we have on file here? Yeah, that looks good. Anything different? Very good. Okay. And what about your family history? Anything different? Any changes to that? Wonderful. Okay. And what about your allergies? Any changes there? Very good. What about your medication list? It looks like we have a couple down for you here. Are there any changes to those at all? Okay, excellent. Thank you so much. So, I'm just going to pop on a pair of gloves real quick, and then we're going to be doing all sorts of different palpations around your face. I'll be doing a little bit of inspection, but palpation is the main point of our exam today. So, is it okay if I touch you? Do I have your permission to do that for this exam? Excellent. So I'm going to get those gloves on. Try to be quick about it, and then we'll get started. There we go. Like a glove. So, we're going to begin firstly by just looking at your face as a whole and checking the symmetry of your face. Going to be looking at your facial features. Are there any particular points of concern that you have today that you'd like me to address? Okay, no strange lumps, bumps, masses, anything of that sort. Very good, okay. That's great. So I'm just going to keep just visually inspecting you, looking at the symmetry of your face, looking at your hairline, looking at the symmetry of your facial features. I think you look very symmetrical. You look pretty good to me. So, as I go through our different points here, I'm just going to be writing down my findings, writing down my notes. I have a little checklist here. If you have any questions at any point, you're more than welcome to ask me and I will answer them as best as I can. So now I'd like to just do a couple of tests on your eyes to make sure that your pupils are reactive. So I have a little pen light here, and I'm just going to use this to really quick do a pupillary response test known as the direct consensual response test. What I'm going to be doing is putting my hand up between us here and bringing my pen light in obliquely into one eye. The eye that I'm shining the light into should respond to the light, and that would be our direct response. If I shine my light in that same eye, your other eye, the one that doesn't have any light, should react in the same way at the same time, and that'll be our consensual response. Okay? So all you have to do is look straight ahead. You don't have to do anything special, okay? Alright, so I'm just going to put my hand up here and come in and look for the direct response. And then we'll check the consensual response. Excellent. So I'm just going to look at the other side here. Direct. Great. Consensual. Response. Wonderful. So now I'm going to do a little test called follow the finger, and it's pretty simple. I'm going to have you watch this finger using only your eyes without moving your head, and I'm just going to have you follow it, and I'm just going to watch to make sure that there isn't any impediment on your eye movement at all, that there's no delay, no nystagmus, anything of that sort, okay? So go ahead and just look at my finger here and keep your eyes on my finger without moving your head, okay? We're going to do this a bit briskly, but I want to make sure that I'm checking all the cardinal directions of gaze, that all your ocular movements are normal. Okay, just keep following my finger here. I know it's a bit brisk, but this will help me catch anything that might be worth noting down and looking into. Okay, almost done. You're doing really, really well. Okay, excellent. That's wonderful. So I'm just going to go ahead and note that down, and then we're going to really get into our palpation part of the exam. People are reactive. Excellent. Okay. So during some portions of the exam, I'm going to be behind you, and I'm going to be feeling around on your face, on your neck, your clavicle area, the back of your head, and I won't be in view while I'm doing that. However, I will tell you every step of the way what I'm doing so that you're not surprised, okay? Alright, so I will be just flitting back and forth as I'm doing different tests, but I'll keep you up to date, okay? If you have any pain or discomfort at all, please let me know right away, okay? Alright, so I'm just going to move my little table out of the way here, and then I'm going to start by looking behind your ears and palpating behind your ears, okay? Alright, so I'm going to get up and just move to your side here, okay? So I'm just going to take a look behind the ears here. So behind the ears can be a nice little hiding spot for lesions or possible abnormalities. behind the ears. It's going to be a touch firm. Just feeling here around the mastoid process. Okay, down. How are you doing so far? Okay, pressure's okay? Alright, very good. So now I'm going to start feeling your different lymph nodes. We're going to start right here at the hairline, at the occipital nodes rather. So I'm just going to feel along here, and I'm going to come out by the ears. And then I'm just going to feel a little bit above the hairline. And a little bit below the hairline as well. Any pain or tenderness in this? Okay, excellent. So now I'm going to go ahead and feel the post-auricular nodes. So the post-auricular nodes are going to be behind the ear. I'm just going to do a thorough check here. Make sure there isn't any distension. Sometimes you can feel a little bit of distension right here, a little bit of swelling if you have an ear infection. Sometimes it doesn't mean anything though. I have a permanently distended lymph node right here at the base of my left ear. It's a little bit of an oddity, but the human body itself is quite an oddity, quite a marvel. Okay, so now I'm going to feel the pre-auricular nodes. So that's going to be right in front of the ear. Right here. Any tenderness when I'm doing this? Okay, very good. Okay, so now I'm going to be feeling for the submental nodes, and that's going to be right down here, right under the chin there. And I'm just going to be, this is going to be a little bit of an odd feeling because I need to really be able to feel the nodes against a hard surface. So I'm going to be pulling the skin along the jaw so that I can feel them along the jaw, along that hard bone there. It's a bit of an odd feeling. Shouldn't be painful. If it is, please let me know. Okay, very good. Alrighty. So now I'm going to go ahead and move to the submandibular node. So it's going to be right under here. As I said before, there's a lot of palpation in this examination, but it might feel more akin to a massage rather than a standard exam. It's not one that's used very often. However, if it's employed a little more, then catching and preventing any oral cancer would really benefit from that. Okay, so now I'm going to feel your anterior cervical nodes, and these are going to be in the neck here, okay? So what I'm going to do is I'm going to kind of move your head around, and I'm going to be just turning your head to the side, and then I'm going to be bringing it down, okay? I'm just going to turn your head and bring it down, okay? And then I'm just going to be feeling along the sternocleidomastoid muscle, and I'm just going to be really rolling the skin here in order to feel any possible swollen lymph nodes all the way down to the clavicle, pretty close to the sternum. Okay, and now I'm just going to turn your head again and then down, and then I'm going to feel the other side here and just really gripping and rolling the skin so that I can feel for any distended lymph nodes. Down to the sternum, to the clavicle. Okay, excellent. So now I'm going to be feeling the post-cervical nodes. So this time I'm just going to turn your head to each side, and I'm going to feel just behind the sternocleidomastoid muscle. So I'm just going to have you keep your head to this side. You don't have to keep it down anymore. And I'm just going to be feeling along behind the muscle there. Okay, and the other side, I'm just going to gently turn your head and then work down along that muscle. Okay, so now I'm going to come in front of you for just a moment. How are you doing so far? Okay, that's good. So now I'm going to have you bring your shoulders up, and I'm going to feel along your clavicle and feel for your supraclavicular nodes, okay? So if you could just shrug up. Very good, okay. I'm just going to feel along your clavicle here. Any pain or tenderness in this? No? Doing okay? Alright, that's great. Okay, very good. That's great. You can go ahead and relax your shoulders down. Alright. So now I'm going to be feeling for different glands in your head and your neck as well. We're going to start with the parotid gland. We're going to check the submandibular gland, and then we're going to do the thyroid gland as well, okay? So I'm just going to be stepping behind you again for a little bit. All right, excellent. Okay, so the parotid gland is going to be right in front of the ears here. So I'm just going to feel around here. And I really shouldn't feel too much at all when someone is healthy. Okay, and now I'm going to feel your submandibular gland. I'm going to have you put your tongue to the roof of your mouth, please. Very good, and that really helps me out to be able to feel in that submandibular region. Oh, this is a little bit of a weird feeling here. Most people don't really acknowledge this part or touch this part right underneath the jaw in the back area. It's a bit odd. Okay, and now I'm going to be palpating your thyroid gland. So I'd just like to take a look at it first. There we go. Okay, so the thyroid gland. Just going to be looking for symmetry here and making sure that there isn't anything that's really noticeable. Okay, so I'm going to have you swallow for me while I'm palpating that. Okay, very good. That's great. And I'm just going to take a look. And if you could cough for me, that would be great. Okay, that's very good. All right. So that looks really healthy. So now I'm going to go ahead and come in front of you, okay? There we go. All right, so I'm I'm just going to go ahead and document some of my findings here. You're doing really, really well. I appreciate your patience. Appreciate you sitting so still for me. Very good. So now I'd like to just check on your larynx, okay, your windpipe, and I'm just going to be trying to move that from side to side. It will feel a touch uncomfortable. Please let me know if there's any pain at all, okay? So I'm just going to check on the larynx here. It looks like it's right in the middle. That's very good. And now I'm just going to try to very gently move that from side to side. Okay, that's very good. If it was more immobile, then we would have to look for any inflammation or a possible mass in the thyroid area, but that is a-okay. Just going to note that down. Okay. And from now on, I'm going to be right in front of you, okay? So firstly, we're going to check on your TMJ joint, your temporomandibular joint, all right? So I'm just going to put my fingers right in the joint there, right here, okay? And I'm going to have you open your mouth for me and close. Okay, any pain or tenderness there? Good. You open your mouth and close. Open your mouth, close. Okay, and can you just move your jaw, shift your jaw forward? Jot it out. And then can you move it back and to the left and to the right? Okay, very good. All right, you can go ahead and relax your jaw. Oh, have you noticed that area is a bit tense at all? Yeah. Do you happen to clench your teeth at night, or even when you find yourself being stressed? Okay. Yeah, we might have to take a closer look at that. We might have to see if we need you to wear a mouth guard or some sort of protection so that you're not grinding on your teeth so much, because that muscle feels pretty tight. There aren't any masses, there's no lumps, but it definitely feels a little tight, and you did say it was a touch tender, so may have to look into that a bit. So now I'm going to check your mouth opening. So I should be able to fit at least 3 fingers in your mouth. So I want you to go ahead and open your mouth for me. Okay, and yep, that looks great. Okay, very good. Okay, and now we're going to check the masseter muscle, okay, right in the same area as the temporomandibular joint, and I'm just going to be checking all around from underneath the cheekbones all the way here. I'm going to be feeling the points of attachment and everything in between, okay? So I'm just going to feel in here. I want you to clench your teeth for me, okay? Feel around for a little bit. Okay, and then can you relax your teeth? Relax your jaw. There we go. Okay, and clench. Very good, and relax. Alright, that's excellent. So now I'm going to be feeling your temporalis muscle, which is going to come in this area, in your temple area, and a little bit into the parietal and temporalis bones, okay? So I'm just gonna be palpating here all around this area, okay? Now I'm gonna have you go ahead and clench your teeth. Okay, and relax. And clench your teeth. And relax. Okay, very good. So I lied a bit earlier when I said that I was going to be in front of you from now on, because now I'm going to have to check on your sternocleidomastoid muscle, which is best for me to do in the back. So I'm just going to check on the muscle that's right in here. If you turn your head, you can really see it right there. It's a very powerful muscle there. So I'm just going to stand up and go behind you and we'll check on that, okay? Right. So I'm just going to turn your head away and down so that you're looking down and away. And that really accentuates the muscle there. And then I'm just going to palpate along that. I'm just going to start at the point of attachment here and go down all the way to the final point of attachment. Okay. Any pain or tenderness in any of this? Alright, that's great. So now I'm going to turn your head to the other side and we'll have you look down. Okay? I'm going to feel around the mastoid process, the point of attachment, and then we'll go down. Very good. You're doing really, really well. Very good. Okay, so now I'm going to come in front of you. This time I promise it's for good. So, lastly, I want to just check around your lips, okay? Alright, very simple, very quick. So you can just keep your lips closed and I'm just going to look at the skin of them, how the muscle looks. Okay, I'm going to do just a little bit of palpation here, just a little. Okay, and then can you open your mouth for me? Right, I really want to check in the corners. Okay. Very good. Can you close your mouth and open it and close? Okay, very good. So I'm just going to finish up documenting my findings here. And then I think we are all ready to go for our extraoral examination. So that went really, really well. I really appreciate you being a part of this, being my little guinea pig. It helps me out quite a bit. All right, so I'm just going to sign off on that. Do you have any questions, comments, or concerns for me at all? Okay, very good. So to follow this, we would want to do an intraoral examination. However, for the process for this particular application here, we're just doing the external area, the outer oral area, since we're just practicing, okay? Alright, I really appreciate your services. I hope you have a whale of a day and a good rest of your night. Thank you so much.